There is currently a shift taking place within the specialty, which is switching away in general from the use of IUIs towards the use of IVF. And that is driven to a large degree by some studies which over the last few years have been reported by the person who is now the executive director of the ASRM, the American Society for Reproductive Medicine, and in his previous position as an academic physician at one of the universities, he did some very interesting comparable studies between IUI and IVF, and he showed that IVF in principle is a much more effective treatment. And so the shift that is currently taking place in the specialty changes the standard treatment algorithm that has been in place in infertility clinics for the last 30 years, which always was you try IUIs before you go to IVF, 3 to 6 cycles. Indeed, many insurance companies mandate it. They will not cover an IVF cycle until you do the IUIs, while that is really economically against their interest in many, if not in most cases. Interestingly, we here at CHR, we figured this out probably 15 or 20 years ago. And while I am old enough to remember the days when over 90% of our cycle activity were insemination cycles, were IUI cycles, I also can tell you that in the last 15 or 20 years at CHR, the pendulum has greatly switched. And today at our center, partially due to the patients who come to our center, which are mostly patients who have already failed treatments elsewhere, we do relatively few IUI cycles.